Petrona Ghana.
I'm right here. Just didn't want to record my water drinking.
Okay. BVI finance.
So, step out again. Oh.
Good morning, everyone, and thank you for joining us for this BVI Finance Breakfast Forum. Over the last year and a quarter, our lives have been upended by the global pandemic COVID-19. We've had to adjust how we live, how we work, and how we socialize, and for that matter, how we worship. Uh, we've been in a very good position here in the British Virgin Islands. And I think we are probably one of the models on how to manage a global pandemic. And because of that, we have been able to record relatively low cases of COVID-19 occurrence and casualties in the British Virgin Islands. Joining us today to talk about COVID-19 and the global pandemic and how we are doing and how we're going to be doing going forward here in the British Virgin Islands are two of the experts who have kept this territory and who have done an exemplary job in ensuring that BVI stays COVID ready and COVID prepared. Today we have Dr. Irad Potter. He is the Chief Medical Officer in the Ministry of Health and Social Development. And we are also joined by the Permanent Secretary in the Ministry of Health and Social Development, Ms. Petrona Davies. I'm just going to introduce them to you before I invite them to open their mics, and later on we'll ask them the world of questions. And I know we have lots of questions for Dr. Potter and Ms. Davies. I want to thank all of you for joining us this morning, and I want to thank Ms. Davies and Dr. Potter for joining us as well. Petrona Davies is a self-motivated and focused professional with significant and varied experience in the government of the Virgin Islands. During her extensive career as a public officer, which began in 1988, Ms. Davies served in various capacities before becoming permanent secretary in the Ministry of Health and Social Development in 2008. Among her many responsibilities, she oversees the territory's response to the COVID-19 pandemic as a member of the Health Emergency Operations Center's United Command. Ms. Davies holds a Bachelor of Arts in Sociology and Criminal Justice, a Master of Science with distinction in Governance and Development Management, a Level 7 certificate in strategic management from the UK Chartered Management Institute, a certificate in arbitration from the Chartered Institute of Arbitration, a professional certificate in social development from the International Center for Parliamentary Studies. Ms. Davies is an accomplished executive with a firm commitment to improving the lives of others and demonstrated ability to deliver results. Dr. Irad Potter is responsible for advising the government of the Virgin Islands on health policy, health planning, and programming, and has been involved in policy, legal, technical, and administrative health reform agenda in the Virgin Islands. He has participated actively in the Caribbean community health agenda for the past 31 years. Prior to his current post as Chief Medical Officer, Dr. Potter was the Director of Primary Health Care in the Ministry of Health and Social Development for a number of years. He has a number of distinctions and accolades that go with his name, so I'll just mention some of a few. He was also a pediatrician at People's Hospital, a resident pediatric program at the University Hospital of the West Indies, University of the West Indies, Jamaica. He was also a medical officer one at People's Hospital, and he has done quite a number of publications, including a dengue outbreak among camp participants in a Caribbean island, shared services in the Caribbean countries, sub-regional consultation on PAHO, WHO Integrated Health Survey Delivery Networks, and effort towards integrated health services 21 in the English-speaking Caribbean. He has also published his thesis, including Illness Behaviors with Special Emphasis on Self-Medication, a survey of diabetic and hypertension clients of the Augusttown Hermitage Community Health Center. He published in Kingston, Jamaica. He has a number of professional affiliations and titles, including working with PAHO. He's been also with the CARICOM community, and a number of designations, which are just too numerous to mention. I would be here for most of the morning if I were to go through them. But he's also been a member of the BVI Social Security Board and currently is still a member of the BVI Social Security Board. He's chair of the OECS Technical Working Group on Sustainable Health Financing, CARICOM Technical Working Group on National Information Systems for Health, a member of the Steering Committee for Policy Brief Development and Stakeholder Dialogue Project. And I'm going to stop there, but he has quite a number of other accolades that go with his name. I want to thank Dr. Potter and Ms. Davies. Like I said, I think they have done an exemplary job with their team in managing this pandemic and ensuring that we in the BVI are in a very good position. And we have been open when many countries have been shut down. Thank you very much for the job that you are doing, for your commitment, for all the work and hours that you've put in to ensure that we are here safe in the BVI. I now welcome you to open your mics and do your presentation.
Good morning, Elise. Good morning, everyone listening. Thank you so much for the opportunity to be here this morning to provide a brief update on our COVID-19 response and speak a bit about the continued reopening of the territory. Given the difficulty you've had, Ms. Donovan, in summarizing Dr. Potter's bio, then you would understand my great privilege in working alongside him and the rest of the team throughout this pandemic, as challenging as it has been. I described it one time as the highlight of my career in terms of how much we've learned and been able to achieve by working together across the government and across the society to put the BVI in a strong position going forward. So I'm really looking forward to the exchange today to see how we can incorporate new ideas, respond to any questions, and move forward stronger together. I will attempt to share my screen. I trust that everyone can see that well. So today we'll be discussing, as I mentioned, the continued reopening of the BVI, specifically looking at the public health and social measures and how we adjust them as we continue in this reopening process. And this presentation I'm making on behalf of the Health Emergency Operations Center. So we'll be touching on the National Action Plan that guides our work, the framework that will be applied in adjusting these measures, an update on where we are now in terms of our COVID-19 situation, and briefly highlight some of the key considerations for employers moving forward. And then we'll speak a bit more about the way forward. And at that point, I'll transition to Dr. Potter's presentation. So persons may be aware that we do have a national action plan that was developed. Well, truth be told, it evolved from our national pandemic preparedness plan that had been developed over many years and then adjusted to the COVID-19 outbreak and released again in 2020, specific to our response to COVID-19. So it's all of government, all of society, and it outlines the key actions that will be taken as we respond together to this threat to our community. The plan is set out in 6 phases. And when the first 2 cases were detected in late March of 2020, we transitioned to stage 3, stamp it out. And we've been sort of oscillating between stages 3 and 4, depending on the extent of infection at any given time. Along with that, we've been, as you know, implementing a range of public health measures to try and prevent first and then control the spread of the virus in the territory. There are actually 5 levels based on the WHO framework in this regard, but level 0 would be no cases at all in the last 28 days. And level 4 would be, let's say, the situation that we're seeing in a country like India, where there's basically uncontrolled spread. And we certainly hope to never get to that level. But in terms of the main levels that we've experienced and that we're preparing to be able to respond to if necessary. So at level 1, cases are well within the medical and isolation capabilities. Effective measures are in place to prevent and control transmission. The emphasis at this level is on case and cluster detection through our screening and testing, etc., investigation, tracking and tracing of contacts. And daily activities and services remain open with safety measures in place to limit the risk of spread. So it's safe to say that we're currently operating at that level and preparing to ramp up our response, knowing that we can very quickly, as we've seen in some countries in a matter of a day or 2, elevate to higher levels. So at level 2, the risk of transmission beyond clusters is present. So certain measures are applied to limit social encounters and to control transmission. Education settings may remain open with infection prevention and control measures in place. Businesses remain open with safety measures in place, but teleworking is encouraged. And then at level 3, these terms are often misused, but community transmission means that there's quite a significant level of local infections acquired locally. We might be limited in our capacity to respond because of the volumes of cases. And this then poses a risk of our health systems becoming overwhelmed. Closure of non-essential businesses then becomes necessary. And all businesses that can work remotely will continue as much as possible. At level 3, we also limit in-person instruction and institute e-learning. And mass gatherings may be suspended altogether. and the size of social gatherings may be decreased. So in terms of our current situation, we know that the risk level everywhere is very high. Globally, there have been over 168 million confirmed cases. And we know the reality is that each of these figures is probably 2 or 3 times higher in reality in terms of case counts. There have been 3.4 million deaths. And in the Caribbean region, similarly, alarming figures in terms of COVID-19 cases approaching 800,000 and close to 11,000 deaths. And these are among CARPHA member states as well as non-member states in the Caribbean region. Locally, we have 289 positive cases detected to date. 6 of those cases remain active. And we've rolled out a vaccination program. We're very fortunate to have been blessed with COVID-19 vaccine donations. We've administered 11,696. In fact, more than this data is probably from 2 days ago in terms of the vaccination doses, and over 5,000 second doses. So we're inching closer to 50%. We're probably at 50% now in terms of first doses, and 22% or more in terms of second dose. Now, this is the projected adult population. As you know, AstraZeneca vaccines are not yet approved for use in children, and our target right now is at least 70% vaccination of the adult population. So we have quite a way to go in terms of full vaccination of the adult population. So our efforts in that regard continue, and Dr. Potter will speak a bit more about vaccination in a few minutes. So in addition to the overall action plan, we developed early in 2020 in connection with the first set of lockdowns, an internal reopening and restricted border reopening plan. And in respect of that plan, we're in the 3rd phase, where we've seen the curfews lifted, the gathering sizes increase, our schools are reopened for in-person instruction, all categories of businesses and recreational facilities are allowed to operate within certain guidelines. Our ports are reopened to visitors. There's still a bit of restriction in terms of travel by sea, and work continues there. And many of the travel restrictions have been eased, as you've heard very recently, in terms of the easing of restrictions for persons that have been fully vaccinated. So in all our work, we bear in mind some key considerations for controlling transmission in the territory. So among those are these 5 listed here: sufficient health system and public health capacities in place, outbreak risks in high vulnerability settings minimized, and high vulnerability settings include healthcare settings, homes like the Adina Donovan home, and other residential facilities, the prison, etc., where the risk is particularly high. We also actively manage the risk of imported cases. Workplace prevention measures are also important to maintain. And another key element of our strategy is to ensure that our communities remain fully engaged. So just a brief update on where we are in terms of some of these areas. Where health system and public health capacities are concerned, we continue active surveillance and contact tracing, quarantine and isolation, screening and testing facilities have been established. In terms of care, there's a dedicated special care unit at the hospital, which has been developed to isolate and treat COVID-19 patients that require hospitalization. That unit has 16 beds and 6 ICU units are also available. We've enhanced our more capacity and conducted refresher training on our mass fatality plan, hoping never to have to activate it. We've engaged healthcare professionals in collaboration with the Cuban health authorities. And of course, as I mentioned, infection prevention and control protocols are in place in healthcare and other high vulnerability settings. With regard to managing the risk of imported cases, I think we'll all be familiar with some of our protocols in that regard. Pre-arrival screening continues, assessing residences and vessels and other locations for quarantine. We have mandatory arrival screening and testing and quarantine in place as well. And along with that, we have geofencing devices and other methods of monitoring, and of course, the follow-up testing based on your category upon entry. In terms of workplace prevention measures, guidance on these measures have been issued to all categories of businesses, and we are aware that the social distancing task force is in operation, and their role is to ensure that the virus suppression and control regulations are being implemented. So at this point, and looking ahead, some of the key considerations for employers I'd like to touch on briefly. So we know that managers are responsible for maintaining a safe environment and healthy operations. And this is encoded in the labor code and in other pieces of legislation that govern both public and private sector operations. We also expect employers to be sure that proper arrangements are in place and continually enhanced in respect of complying with the prevention measures, and that their preparedness, response, and control plans are kept updated, looking not only at the individual measures, but also at things like your facilities and equipment to be sure that the workspaces are as safe as possible. Management and communications. So looking at areas like employee education, there's a lot of misinformation circulating, and it's important that we provide opportunities for employees to learn more. You can invite in one of our speakers, you can seek other credible sources of information to make sure that we keep our employees apprised of the facts, looking at how we structure the way we work to minimize risk and exposure, particularly if we were to transition to level 2. Employee screening and testing has become another topical issue, and we've been looking at a policy for routine testing of essential and critical workers, front-facing workers who have not yet been fully vaccinated. And of course, employers would need to consider leave policies in connection with COVID-19 leave, that is not sick leave, not annual leave, but perhaps a new area to consider in terms of employment policy. And I will speak more about vaccination, but understanding the level of vaccination coverage in your organization, how to encourage the uptake of the vaccine or to make adaptations where the level of vaccination among key groups, particularly those that are front-facing, whether interacting with a number of clients, or particularly vulnerable, to ensure that proper arrangements are in place for their protection. So where do we go from here? Well, we continue to analyze the situation, and particularly looking now to detect those variants of concern that we've heard so much about that are more infectious, more virulent, and could then be more of a problem, to put it simply, if they were to spread in a community as small as ours. We have detected the B.1.1.7 variant in one person at least so far, but we continue to screen and put ourselves in a state of readiness to respond if we were to detect local spread of one of the variants of concern. We are monitoring and preparing for a resurgence of the pandemic. I describe it as being victims of our own success in terms of the community perhaps feeling a bit relaxed and shielded from COVID-19, which then increases our vulnerability. And we know that with the continued border reopening and tourism resurgence of cases is likely. And so we continue to work to empower communities of front-facing workers, employers, especially to manage the exposure risk. Continuing to support strengthening our health system to respond, and of course, rolling out vaccines and incentives. So we are moving towards this new normal that we are all trying to figure out what that is. I don't think people refer to post-COVID-19 era anymore, because there's probably never going to be a post-COVID-19 era in our lifetimes. But we do need to be able to adjust to living and working safely in the COVID-19 environment. Part of that is a lot of work that we're doing now to support tourism and economic revitalization. Premier would have announced that cruise ships are expected to return with passengers within the next 3 weeks or so. And we are looking at other changes with respect to entry into the territory for recreational purposes. And then we get a lot of questions about why aren't we following the US in terms of guidelines for doing away with measures if you're fully vaccinated. We're not at that point yet. We're not, we don't have enough persons in the population who have been vaccinated to be able to move in that direction. But we are considering the transition in terms of relaxing restrictions as the vaccination rates increase. So Elise, I will pause there and transition to Dr. Potter, if you would like to go straight into that presentation. Thank you so much.
Dr. Potter, thank you very much. Patrona.
Thank you, Elise. Good morning, all. It is a privilege to be able to have this conversation with you this morning. I selected the no conversation because I expect that we're going to be back and forth speaking together as we explore your concerns and provide for me the opportunity to learn from you what your concerns are, what things you think we could do differently. I'm always excited when you have suggestions. Suggestions won't always be accepted, and we won't fall out over the fact that we may disagree about something on this call. I expect that we'll continue to leave all bridges open so that in case we need to pass this way again, we'll feel comfortable having the exchange again if we need to. It is true that it is very unlikely that we'll be rid of COVID-19 in the immediate near future. It is posited that COVID-19 will remain with us, and as we gain more immunity within communities globally, that it will become a mild disease in that not that it will lose its capacity to have serious impact on human beings. It's just that we'll be less vulnerable because we will have some immunity. I want to share a little bit with you about vaccines and vaccination. And I also want to share with you about one thing in particular, testing in the BVI. And I'll start with testing in the BVI. I know that a lot of you would have noted a lot of dialogue in our community about false positive tests. I think there is a notion that if you're fully vaccinated, you shouldn't be testing positive. The strategy that we've utilized for testing tries to ensure that we can minimize the risk to our population. And it is coupled with a number of other strategies, including quarantine. And we've been adventurous in shortening the quarantine period when we feel comfortable that we have sufficient capacity to manage the situation. Now, P.S. Davies did say that perhaps we've done too well in terms of being able to control the impact of the virus thus far. And perhaps it is part of the reason why our population seems to be quite complacent and not really that concerned about having their vaccines. So let's talk about false positive. The test that we do in the lab is called a real-time PCR test. We take a nasopharyngeal swab. It's not a nasal swab, it's not at the front of your nose, it's way up in the back. In fact, most people explain it as, I think they were trying to get to my brain. So it's a nasopharyngeal swab for the said purpose that is the area in your body where the virus is best sampled. We have not gone to other sampling methods because we want to ensure that if it is there, we have a good likelihood of picking it up. You will also note that we have not introduced rapid antigen tests until now, when discussions are beginning in the Ministry of Health about the introduction of rapid tests for some aspects of the management of the pandemic. So we've stuck with the gold standard test, which is a real-time PCR test. Let me say that routinely, when the PCR test is being run, every batch of tests is run with controls. That is, samples that we know are positive and samples that we know are negative, so that if something goes wrong in the testing, the controls will either read right or read wrong. Let me also say that it is our policy to, if we have a positive that we are unsure about, we always retest using a second PCR methodology. We have two methodologies that we can use in our lab. And if we are still not sure, we send it off to our reference lab in Trinidad for them to test it as well. So a false positive PCR test is something that is rare. And when there is a false positive result, it is usually not a result of the lab test failing. The lab test is looking for pieces of the virus. And so if the virus is present, it's basically yes or no. And the test is run by cycles. And the longer the machine has to cycle to recognize that the virus is there, that is the number of cycles that are run. It gives us an idea of whether there's a high load of the virus in a particular sample. In addition, the lab at the Orlando Hospital has been accredited. We have signed up with the American College of Pathologists for their accreditation program, and our staff do the proficiency testing twice a year. So we have an accredited lab, and we participate in an external review proficiency testing program. I have no concern about the lab results in terms of a false positive. It is very unlikely. If the lab says that there is a positive test, it means that there is presence of the virus. And so I know there's false positive associated with a number of other methods, but you don't generally get this with the PCR methodology that we use. And we have, from the beginning, we were fortunate that when this disease was declared a pandemic, we already had PCR testing capacity. So we were able to quickly purchase kits for testing for SARS-CoV-2, that the virus that causes COVID-19. So for those who are looking for an excuse or some reason to blame why their friends who come fully vaccinated are testing positive, it is just that unfortunately persons who are fully vaccinated can still be infected by the virus. They can still carry the virus, And if you can carry the virus, it is likely that you can transmit the virus. So, and it may be as simple as a sampling error. Why somebody who is negative, who's positive may not test positive. But once you have a positive test, it means that we located that virus in the specimen. With regard to other things that happen, you sometimes in a lab you have cross-contamination. Well, we are very finicky about cleaning our lab, so I don't think that there's any issue there as well. So having dealt with that, I pivot to vaccines and vaccinations. The BVI is fortunate. We do have vaccines, and if you had asked me last year this time if there was going to be a vaccine for COVID-19, I would have said not maybe until April to June of 2021. However, a vaccine became available in December last year. I know there's concern with how quickly the vaccine was developed, but let me assure you that there were no shortcuts taken in the assessment processes by any of the regulatory bodies. I can share with you what some of the things that happened are that cause us to be able to have a vaccine so quickly. The process, which normally would have you submit your dossier of phase 1, 2, and 3 testing, was shortened by the fact that you were allowed to, as you completed phase 1, submit to the regulatory agency. So by the time you were ready with phase 3 results, you had already passed phase 1 and 2. And that in itself allowed the capacity of the system to approve the tests quicker. In addition, be mindful that we are in a global pandemic. Everything has stopped, everything has changed. And all the resources that could be made to bear on this situation were made to bear on this situation. And therefore, scientists were moved around, expanding labs, building new labs. Monies were available to do all of those things from the private sector and from governments. So in fact, there were no shortcuts in the processes. And there are 7 vaccines that have been approved by WHO for emergency use. Why emergency use? Emergency use is because production of a vaccine normally takes a very long time. Vaccine testing and assessment does not stop with phase 3 of the trials. Vaccine assessment continues once the vaccine is rolled out for years to come. In fact, something like polio that has been eradicated from the English-speaking Caribbean. And indeed, the first region to have eliminated polio was the English-speaking Caribbean. We still report every week to the World Health Organization anything that we think may look like polio. And this happens for all of the vaccine preventable diseases that we continue to monitor. One, while we are pretty sure that we've eliminated some of these measles, polio, and a number of other diseases from the region, reintroduction from a region that still has any of these diseases is still a possibility. So most of you would have had childhood vaccinations, and you would have gone dutifully because your parents took you. I know most of you who have children and would have taken them for vaccinations. So it's not that you don't believe that vaccinations work. You do believe that vaccination is able to protect us from disease. However, I can understand this is a new situation, a new disease, a new vaccine, and it hasn't had the benefit of many years of trials and experience in the field. So why am I so sure that this vaccine is safe? And why am I so sure that this vaccine works? Well, a lot of what happens in life is because we honor and respect the authority of certain bodies. And the bodies that normally authorize medicines and vaccines have, as long as these vaccines are submitted to them, they go through a very rigorous process of checking what is submitted by the country that manufactured the vaccine. And therefore, as I said, they didn't take any shortcuts in these assessments. So I'm very sure that these vaccines are both safe and that they work. I don't want to spend a lot of time talking about things that I think you may have questions about. I want us to pivot to questions. I want to say two other things. One is that the BVI early made a decision to purchase vaccines through WHO from the COVAX facility. So we made a down payment, and in fact, we didn't take up the first offer of vaccines from the COVAX facility because of the donation of vaccines by the UK. The UK has been generous. We have more than 30,000 doses of vaccines. And unfortunately for us, we have more vaccines than we will be able to utilize given the drop-off in the uptake of the vaccine. So if I'm to ask one thing of you, is that if there's anything that is of a concern to you where you haven't as yet had your vaccine, let me see if I can help to clarify and maybe contribute to helping you to go and get the vaccine. At this point, the last thing I would say before we open up for questions is that we have had many tools that we've employed to help to control the virus. The vaccine is just another such tool. No vaccines are 100% effective. And I'm sure you would have heard of breakthrough COVID infections. Well, we have a new situation and the knowledge is going to be constantly changing. And therefore, what we recommend from time to time will change as there is new knowledge. Good and bad, we live in an age where everything is almost instantaneous. And so every publication anywhere in the world can be seen around the world in a matter of seconds. And therefore, a lot of research material get into the public domain before they're peer reviewed. And so if there's one little study somewhere in a far off place, it gets into the mainstream media. It's good in that we are responsive and the community is searching for answers, but it's also bad because we don't always get our information from the best sites. And I always propose when I speak to people about in these kinds of situations that to be absolutely certain that the persons who regulate medicines have had a look and have a position on something, I always recommend that you go to WHO-INT or PAHO.org. And because we are so close to the United States, I don't leave out CDC.gov. At the same time, the national authorities usually have guidelines that position their own country. In other words, they're looking after the health of their own population. And so we don't tend to adopt things simply because a CDC or another national regulatory authority has indicated a particular stance for their country. We look globally and we look at our own situation and we look at our own capacities and we make decisions based on what risk we think we can manage. I'll stop there and allow you to have your questions and comments. I will try not to speak over you. Please don't speak over me.
Okay, well, we are not going to open the mics. We are asking persons to post your question in the Q&A, and they'll be, and I'll read them out, and then they'll be answered. That's the best method that works for us. So we have someone posted a question, I think, just as soon as we started. And I think one of the things that we've seen is that countries are given all kinds of incentives to boost vaccinations. Someone won $1 million yesterday, and people are winning airplane tickets and hotel trips and all this stuff. So the question is, how is the BVI boosting the COVID-19 vaccination program to protect its residents when the borders fully reopen, and to take the BVI off the UK's high-risk amber list of jurisdictions that require extensive quarantining upon return to the UK?
Let me first say that we really have no control over how countries grade us. Unfortunately, we have a very small population, and 1 or 2 cases per 100,000 reads like a lot. So usually, if you just simply look at the ratios that we use internationally in health, a small number of persons in the BVI looks like a heavy weight and a heavy burden, which in practical terms is not quite true. And furthermore, we are very active in trying to inform national health authorities overseas, in the UK and in the US in particular, about the circumstances surrounding our cases when we do have cases, because to help them to understand the local context. However, if they just stick to the math, a small number using a global ratio always makes us look bad. Doesn't matter what sector it is. So what are we doing? We're not doing a whole lot yet, but all of those types of incentive strategies are being considered. There's a long list of things, and there's some cooperations being planned with the private sector and government to incentivize the taking of vaccines. Of course, people will always say that you're trying to buy us or you're trying to bribe us. That is unfortunate, but I think there are some simple things that actually have increased vaccine uptake in some countries. The fact that people can travel, as simple as that is, has caused people to say, well, if I will be able to travel, then I'm going to take my vaccine. The fact that you can reduce taking your mask, having your mask on in certain settings, people have also seen that as an incentive, because other people always had a difficulty with mask wearing. Simply producing an app or a CAD so that people can be members of a CAD carrying club has had an impact in some countries. And then there are the prizes and the raffle type things that we see in other countries. I don't know that we'll have many of those $1 billion type things, but certainly there's a whole slew of those things that are being proposed. And I expect that we will out within the next 2 weeks.
Oh, get us $1 million prize and we'll all be there. When the borders reopen, and should we have a spike in cases because insufficient numbers of the adult population are vaccinated, how will intensive care beds be allocated? I think Ms. Davies answered that question early on. So if you just want to briefly recap, but I believe you answered that question.
Well, essentially, normally in healthcare, resources are applied as needed, and there are considerations that always take place in the healthcare setting. Some of those only take place in the head of the doctors, and some things are institution policies with regard to what particular clinical path treatment of a particular patient will take. And a lot of that depends on the circumstances of the patient. A general rule is that you try not to do any harm, 1. And 2, there's always a dialogue about, well, if you only have 1 and we have 3 persons needing it, which one do you give it to? again, that a number of factors in terms of the risk for that particular person, the presence of other comorbidities come into consideration. And there's nothing that's written down and it's dealt with on a case-by-case basis. So it's not a question that I can say a yes or no to, because every case is going to be different, and the circumstances that inform the management really depends on what's happening at that particular time. We have always said that whatever resource capacities we have, we really hope not to have to use them. So yes, we have those beds that we have outfitted, and we have some ICU capacity that we've increased, but really we hope not to have to use them. Fortunately, to date, we've only had one death, and we've only had a very small number of seriously ill persons, and fortunately those persons did recover. But the rationing of healthcare is not something that is necessarily new. It's just that it's something that institutions have policies about, and then the conditions of the particular situation is dealt with specifically to that situation. So there's no hard and fast rule that is applied. Thank you.
Okay, the next question are employers mandated to allow their employees to be vaccinated, or can they prevent, dissuade employees from getting their vaccine?
There's no government mandate. However, since it is the responsibility of employers to ensure a safe work environment, and since vaccines are available in the territory and they are safe, effective means of controlling the spread of the virus, it means that persons who are in higher risk areas of our workplace the employer can ask them to be vaccinated. 2, persons can be repositioned from that front-facing space to another space within the organization. And if it is that persons are not non-compliant, it is really the policy of the organization that provides the guidance for what they can and can't do. When these things like a pandemic occur and everybody gets thrusted into it, the usual thing is that you have your current staff, and therefore you try your best to maintain and keep your current staff working and employed. But things vary across organizations, and it may not always be possible to keep the organization running if you don't remove people from the risky areas, particularly if they have chronic diseases or anything that might cause them to have a predilection to have a bad outcome. At the same time, employees are also not to discourage persons from being vaccinated. So there's no mandate from the government. However, an employer, as part of the employment policy, their workplace policy, they can ask that person be vaccinated. And for some, we always speak about, I have a right, I have a right, I have a right. But all persons that have rights also have responsibilities. And protecting the workplace is not just the employer's responsibility. No person should willingly and knowingly endanger other persons in a workspace. And there have been cases across many sectors where such has happened, and people have been sued. I think we always tend to become hesitant when people say they're going to sue. But the truth is that if it is a reasonable expectation that if you're going to be having these exposures and you would cause risk and harm to the people who you work with or the people that you serve, then it is reasonable that you be asked to be vaccinated. And individually as employees, we may find ourselves having to make a decision as to whether we want to go or we want to stay. Because God forbid for any business that we have an outbreak in an office and then the office has to close. The impact of that is that everyone in that office is now affected. And it may be that everyone in that office now become unemployed. These are not easy decisions, but in this very trying time, they are necessary decisions. And if it becomes necessary for the continuity of the business, it is not unreasonable for an employee to have to leave their work in order to sustain their business. Thank you.
Okay, it seems we're getting a number of questions, so we're going to move on quite swiftly. In overcoming complacency to the virus in the BVI community, can business, political, etc. leaders be encouraged to lead from the front and help protect the community by getting vaccinated themselves and encouraging others to do so?
I think that was one of the early strategies that we used. On the day when we began the vaccination program, a number of legislators presented themselves for the vaccine. The premier didn't do it on the first day, but he eventually did it and did it on camera. I myself, I was on leave, but I put on my clothes and I went to the ceremony because I thought it was important that if I was going to be asking people to take the vaccine, that they see that I had no challenge to take the vaccine myself. And I encourage other colleagues who were present at that time to also come forward and have the vaccine, because if we who are promoting the use of the vaccine are hesitant to have the vaccine, it's not a good sell. In addition, some employers have done a very good job. There are employers who have said to me, I have 21 staff and 21 are vaccinated. And in that particular workplace, the lady said to me, and the one that's still outstanding is going on Monday. So, and that happened many months ago, several months, at least 3 months ago. So I believe that it is a good look if the persons who are in positions of authority do take the vaccine. I think though that it is difficult, it's not an easy decision and persons should not be ridiculed if they're hesitant. I think forums like this can help people to look at the reason for the hesitancy. And really it is for a lot of inward looking for you to come to grips with, why am I really not taking the vaccine? Because what you tend to get is you manufacture one logical reason why you shouldn't take the vaccine, and then you keep looking for others. So even if you're told and you have better knowledge about one, every time a new myth comes around, you latch onto that as well. So the consideration really is that we cannot rely on other people to make us safe. However, persons who take their vaccine make it safe for other persons. However, and P.S. Davies has a way of putting it, and she probably will know what I'm talking about, so she'll let her say it when she gets a chance. But in essence, you are at risk because you are alive in 2021, and we have a global pandemic that is out of control everywhere in the world. Even the countries where the numbers are coming down, the risk remains high. As long as COVID is present anywhere in the world, we all remain at risk. We can reduce our risk by taking the vaccine.
Okay, we have a number of questions. I'm going to combine the next two questions and then you can answer. What are the re-entry procedures for persons who are fully vaccinated? And are there considerations being made for professional visitors who are on work-related assignments and require a swifter processing?
The current process, if you're fully vaccinated, is that you apply through the gateway and you follow the protocol as outlined on the gateway. You'll be tested 3 to 5 days before you travel. You'll be tested on arrival, and you will be in quarantine until you receive that test result. I always smile a little bit when we get asked these questions about making it swifter and making it shorter. Actually, BVI has kind of led the way in shortening quarantine periods. We are not there yet to say you can just simply walk off the plane and go home. But one of the things in life is that we try to have, not to favor any sector of the population. And so from the time we started this, our consideration was that every living human being can get COVID. Therefore, any living being that comes across the border may have COVID. And therefore, we have looked at some modeling and decided that what risks are we willing to take given the capacities we have? And therefore, now with the vaccine, so far, generally, the information is that if you are vaccinated, you can carry the virus, but you may not transmit the virus as easily as before. And the colonization of the virus is less in the vaccinated persons. However, that information is fairly new as well.
Okay, Dr. Butter, we have a number of questions coming up, so maybe I should.
So the short answer is,
so,
irrespective of your profession, we only have one protocol.
Okay, so, and are you also giving vaccines to visitors? That was another question.
We haven't targeted visitors because the vaccines we have are donation targeted to the resident population.
Okay, I am uncertain about
the site.
Okay, I am uncertain about taking the vaccine because it is still unclear on what is expected after taking the initial first and second doses, such that whether persons will be mandated to take booster shots. How many booster shots, and if a booster shot can be optimal, as with the flu, booster shots annually, recognizing that we are a community that has never promoted taking annual flu shots.
SARS-CoV-2 is a coronavirus. There are about 4 coronaviruses that cause a common cold. And you would note that it is a frequent guest. It seems to always be with us. It is very likely that this SARS-CoV-2 organism will hang around. 1. 2, it takes years to determine how long immunity from a vaccine will last, or how long immunity from infection with a disease will last. There's a lot in the printed literature about whether people who get the disease will have lasting immunity or not. Initially, they said no. More recently, I'm seeing that they're saying they may have longer lasting immunity than we previously believed. The truth is the time has been short between the appearance of the virus, the development of the disease, and the time since its rollout. So only time will tell. However, because this virus is mutating and creating variants and variants of concern, it is very likely, and the vaccines that have already been approved for emergency use, those companies have already pivoted to developing vaccines that can take care of the current variants of concern. So it is very likely that we may have to take a booster, and it is very likely that it may become an annual thing.
Okay. Yes. So I have a number of questions, but I find the next question quite interesting. The US has not approved the AstraZeneca vaccine, and as a result, people vaccinated with AstraZeneca vaccine are not considered to be vaccinated by the United States. Do you know of any efforts by the UK or the BVI to change this? This is interesting because I think the point that we most travel to, or the place we most travel to, is the United States. And if they're not accepting AstraZeneca, then what's the point?
I must say that that's new to me. That's news to me. I will have to look into it. However, what I can say is that the process of approval of vaccines, the companies that make the vaccine would submit the vaccine data to the regulatory authority in a particular country. So what I'm not sure why the US has not approved AstraZeneca yet for use in the United States. And it may be simply be economics. They have the 3 vaccines that are manufactured in the United States, and they've made sure that they are widely available. So they may not actually have a need to be rushing to do it. But I don't know that because a vaccine is not approved by the United States, that they won't accept that a person who has a particular vaccine is not immunized. I know that the AstraZeneca vaccine is going to be manufactured in the United States. So it is unlikely that, again, that if they don't approve of the vaccine, that they will approve manufacturing of the vaccine in the United States. So I think it's just a matter of time before those processes sort themselves out.
Well, interestingly, some countries are taking that position. For example, China, I understand from people in China that if you have the Chinese vaccine, then you're allowed to come in and move freely. But if you have another country's vaccine, then it's not accepted. So
the word is politics.
yes, so yeah, it's become politicized, I guess. This is, I guess, more a comment than a question. It's like, can we have billboards or signs disproving the common misconceptions of the vaccine plates in strategic areas like the grocery store and the roundabout? I'll move on because we have a number of other questions in the post, and you can respond to that if you like. With the implementation of sanitation stations as COVID prevention measures by all businesses, the community has seen a reduction in other normal viruses around the community like flu, stomach flu, and to the like. This has been a positive measure that some may feel this needs to remain, even as COVID easing measures are being considered. Is it possible that government to demand and enforce that businesses continue indefinitely to keep their sanitation stations and continue to ensure that customers entering the businesses use them?
That depends a lot on what our community will want to tolerate. It is true that, for example, the last flu season, there was definitely globally a decrease in the occurrence of flu as a concern. Gastrointestinal diseases as well also went down. So I think the things that teach us in kindergarten about washing your hands, etc., I met them when I came. I think they're not emphasized as much as they used to be because we don't have, in other words, the things that cause illness and death in the world have kind of shifted, and only the poorer countries are having a lot of gastrointestinal diseases, etc. And so people get laxed because they don't perceive the risk. So hand washing was promoted a lot when we were growing up. So it may, and there are countries that have kind of criminalized not taking hygiene measures seriously. And in fact, those countries do a lot better with being able to control outbreaks. So there is some merit to it. It is something for consideration and discussion in the community. And perhaps if we really want it, if we ask, we'll get it.
Okay, but you and Ms. Davies said that, because I've been one that has been using the terminology post-COVID, uh, and you said that, there's no post-COVID era, and very pessimistic. So if we're not going to have a post-COVID era, then we need to continue to operate as if we're in COVID and have sanitation stations. Anyway, I'm moving on to the next question. I am a dialysis patient. I am fearful of taking the vaccine because I am not sure how my body will react to the vaccine, or if the effects from the second dose, which are said to be more stressful on the body, will be too onerous. What insight can you share about this?
But what I can say is that sometimes we get information crossed, but generally, for most people, the second dose of AstraZeneca vaccine has been less onerous than the first dose. Yes, that is not the same thing with some of the other vaccines. And since when we hear information, we don't always specify or are made aware of exactly which vaccines people are talking about specifically, all of the side effects tend to get lumped together. But generally, persons have mild side effects from the vaccines. There's no way to be absolutely sure. And the risk of a serious side effect is as rare as getting struck by lightning. But that still happens to a few people every year. So nothing is absolute in terms of how you may or may not, but you have to also weigh for yourself what the benefits are for you. And I think a lot of people were saying that, well, if we have herd immunity, then I don't have to vaccinate. But you see the struggle we have to even get to 50%. And in reality, one of the considerations that we need to take is this. Even for the vaccines that are designed to be one shot, they're still saying to you, best to wait 2 to 4 weeks after before you consider yourself fully immune, right? So the longer you delay, the more vulnerable you are. And and in a sense, it's been like something between me and PS for the past several months. The BVI is relatively safe. And we don't know that we will continue to be this safe. We do hope that with uptake of the vaccine, it will become safer. But we have the problem with the hesitancy. So the advice generally is that if you have a physician, you speak to your physician because they know best your medical history. And if you don't have a physician, that you develop a relationship with a physician so that there's at least one medical practitioner who has a good sense of your issues and how you have responded to various insults over the years. I try not to become a doctor of individuals and try to be the nation's doctor at that level, because personal things need to be dealt with on a very personal level, individualized level. And so my advice would be simply that if you have a regular doctor, speak to your regular doctor. If you have further queries, you ask your regular doctor to point you to somebody who may be more knowledgeable in about the specific issue that you have concern about. Thank you.
Okay. I'm going to tie in, I have a couple of questions. I'm going to tie them in with this last one. If you are fully vaccinated and travel back to the territory, but someone on the boat plane tests positive upon entry, is that fully vaccinated person required to quarantine for 14 days? And I think you would say no, but
Yes, I would say no. And in fact, one of the things that we recognize that if the boat has open seating, it's difficult to say who was sitting where and who was sitting next to whom. So we've actually asked the boats to begin to to share with us their seating arrangements for each voyage, because it would allow us to have a sense of who was aware in the boat and who may have come in contact with whom. The challenge remains that we tell everybody that was on a voyage to monitor themselves for symptoms. We tell the people who are in direct contact with the persons who are positive to isolate. And so it really varies depending on time, space, and exposure risk. And I get it, of course, it even matters whether or not you are in the cabin with everybody else or you're up in the open air on top of the boat. So when the team goes out to interview people, they'll try to get the individual experience and match that with the exposure as far as possible, because everybody won't have the same risk just because you're on the same boat. However, there's no way to know. So the feel safe is that everybody should monitor themselves for symptoms and then call the hotline if you develop any symptoms. It's again one of those things that we don't have a perfect solution. However, we try to layer the approach so that if we don't catch it one way, there's opportunity for us to determine that there is a risk and exposure that we need to follow up. Thank you.
My question is, normally when you have a illness or you're considered by getting that to have some sort of immunity, it doesn't seem, based on all the information that's being shared, that if you have COVID, that having COVID itself doesn't provide you with the same level of immunity, immunization, I should say, sorry, immunization as getting the vaccine. So why is that? And why is having COVID not considered on the same level of as getting a vaccine?
Okay. One, this virus is a new virus, and we are learning about the virus. And a lot of studies about certain things have not been completed. Some have started. There's always a few studies that come in, and then you begin to make comments on the findings of those. However, generally the early studies tend to be in small populations. Over time, we will have a wider number of people who have had COVID in bigger population groups that can be studied, and we have a wider population of people who've had vaccines that can be studied. If you get COVID, you do develop some immunity. It's always been a concern, well, how long does immunity last? The truth is that it's a very new situation. The virus has only been around since 2019. And the vaccine has only been around since about 12 months later. So the truth is that it is something that is still being studied. And in time, we'll have a better sense of what happens with immunity. What they've noticed, however, is that if you have had COVID and you have received the vaccine, that in fact, you have more lasting and better immunity than those of us who simply have the vaccine. Again, I'll give you the example of measles. We used to give one measles shot. And after several years, we recognized that the immunity was decreasing over time because persons were beginning to get measles again, having had their measles shot. So now measles has become a 2-dose vaccine. When it was first designed, it was designed as a 1-dose vaccine. So the truth be told, it's early days yet, and we are still learning about the impact of the disease itself and the impact of the vaccine on immunity. Thank you.
Are you providing tests for persons to see if they've had COVID, since most of the cases that you've reported have been asymptomatic? So if I want to find out if I've had COVID, can I come and get tested, even though it may have been months before? and there's a test that would show, oh, you had COVID already?
I'm not sure what benefit that information would be to you, except that you may not have as bad an experience the next time you get it. However, there are antibody tests available. The challenge that we had in the early days was that we had no notion of how long the immunity from having the virus was going to last. And so we use antibody tests when we do our investigations. If we have an outbreak and we test people for COVID, some of the persons who've been in contact with that case, we also do antibody tests for them, because it allows us as to whether there were other people in the party who may have been infected previously. In other words, one of the things we're trying to find out is what is the source of this infection? So we do use antibody tests for that purpose currently. Antibody tests, well, let me say this differently. Generally, health does not operate much like your supermarket. There are things you can get from your private doctor that you can't get from any other source, because it doesn't really operate much like a supermarket. And generally, we don't test unless there is a definitive need to test. We don't just test out of curiosity, generally. So within the public sector, just because I feel like hasn't really been a reason that we offer tests to persons. There has to be some threat and basis for doing it. And so, like I said earlier with another question, if you want to know something like that, it's best to approach your own doctor and work that out with your doctor.
So the doctors in the BVI have available the antibody tests to tell you.
I can't say for certain which of them may have it, but I'm pretty sure that some of them do.
Okay. We have another question. With the government increasing the number of persons allowed to enter via ferry, how are the social distancing measures going to be maintained with the space at the ports already being stretched to allow for social distancing in order to avoid any possible transmission of COVID to persons as they enter the territory, the country?
Social distancing, mask wearing, cough etiquette, hand hygiene, checking that you're in a ventilated space. One of the things we say to the ferries is that demonstrate that, given the size of your vessel, what is your normal capacity and how you can change that capacity to allow for social distancing. I think earlier we described that we have layered the measures, and I would say that maybe right now the most important measure is to get a vaccine. A part of the challenge is this. All of the measures by themselves offer some benefit. Layered, they offer more benefit. And the additional layer of the vaccine offers even more protection. I don't think that, I can say that one of the things that was considered when we were approving the boats to return to business was that we looked at their capacity, and in general, they are operating at below 50% capacity currently.
Okay.
One other thing, and also at the port, they are monitoring how many people get off at a time so as to not to cause crowding in the limited space at the port. So they are not allowing everybody to just run off the boats as we used to in the past, but they take off some and then take off some to allow it to be more controlled. And then we have officers who are standing around to encourage people to do the right thing.
Okay. I guess that leads into a question that I had, because I think early on last year, we saw a lot of visibility of your social distancing task force. And I don't recall maybe seeing any, you know, before. You would see them at restaurants and other places. I was surprised that you said that the social distancing task force is still active, because I think their visibility has been decreased. Is that correct, or is that just my perception? Perhaps I don't go anywhere, but
It's not just your perception. We don't have as many officers as we had shortly after the lockdown. And remember, the lockdown really shifted persons from their regular work. So we had more officers available to us to support the social distancing monitoring. But the team is still there. There's some on the major populated islands. And I do hear a report from them every week. So I'm not sure why we're not seeing them.
okay, I think we're coming close to the end, but I had a one question based on something that Petronas said. She said, you've tested one person with the B17 or B17
Yes, that is something I meant to speak to.
variant so
Actually,
far. Before you answer, you know, that we've seen that certain countries have really severe variants of it, and how many of these variants from the different countries, whether it's India, Brazil, South Africa, are being tested for in the BVI, and what is the B17 or 17 variant? I don't remember which one it was. I just have that down in my notebook, but how many of these variants are you testing for here in the BVI?
okay, thank you. First of all, I meant to share with PS Davies, Petrona, that it wasn't the B117. It was actually a P1 variant. So it was actually the Brazilian variant and not the UK variant that we had a positive person for. There are many variants of concern. Some we hear more about. We hear more about the virus that was first identified in the UK, the virus that was first identified in Brazil, the virus that was first identified in South Africa, the virus that was first identified in India. There are many other variants out there. There's some in a different one in New York, and a different one in California, etc. However, some have had more global spread, and so they are more concern to the world generally. The so-called UK variant, which is not really a variant that necessarily originated in the UK. What I can share with you is that the UK is the country that has done the most checking and testing for variants. And therefore, if anybody was going to pick up a variant, it was going to be the UK. We do not test for the variants locally as yet. We are part of a program that is run regionally by the Caribbean Public Health Agency in collaboration with the UK and the University of the West Indies. And we send samples. If we have a threshold cutoff point, and if we have samples below that threshold cutoff point, we tend to send those samples for variant testing. So we are awaiting the results of a batch that was sent, I think last week. So it takes about 2 weeks for us to get back those results. So it's not something that's useful at the moment for management locally. And so I've always said to the team, well, every case is a serious case. Every case is a threat. So until we know differently, by the time we do know, it wouldn't have mattered anyway. So we need to be aggressive in our handling of every case. We are, however, actively exploring, and we've placed an order for test kits that can actually test for the known variants, for the current variants of concern. The company told us that they had a supply problem, but the last communication last week was that they do have the kits in stock, so we placed an order. So we expect sometime shortly to have capacity to be testing for the known variants of concern. We would, once we get the kits, there'll be a period of training for the lab staff on the new kits, which will identify the virus, but also identify the specific variants.
Well, we've run out of time, and you know, there's also a concern about people taking off their mask to cough and sneeze. That's just a no-no. Even I can answer that. But I think we still have a number of questions. We still have a number of concerns. I think you all are doing a tremendous job, and I want to commend you for the tremendous job that you've done over the last year and ensuring the BVI community has been safe. And I would ask you to, because you're speaking to the financial services industry primarily, and this is one of the, I think that we have many people in the industry have been very keen and gone out and getting their vaccinations and so forth. And so you'll be pleased with that. But what I heard today is that, you know, COVID-19 is not going anywhere soon, and that even if you're vaccinated, you can still get the virus. And if you can get the virus, you can still transmit the virus. And that is very concerning. So I would like you to end, because we're like I said, we're on the, it's at 11:30 now, and we usually just finish up at 11:30. But I'd like you to wrap up this presentation, both Ms. Davies and Dr. Potter, your last words to our community. There's a traveling community, and many people have made sure that they get their vaccination so that they can travel more. There are some in the community who are still skeptical for whatever reasons. There's, I think, a bit of bullying and politicizing within this about being vaccinated and not being vaccinated. But I want you to wrap it all up and have a word of encouragement. I don't want you to be pessimistic in telling us that, you know, we're going to be living with COVID forever, because I want to see a new era of post-COVID situation.
Well, I'll begin so that you can end on Dr. Potter's high note. What I meant to say is the opportunity that the world had to really stamp out COVID, let's say when it was in China or in one region of the world, and the measures that would have been necessary to basically end it before it became a pandemic, that obviously that is no longer possible. There are many diseases that have been with us for generations. Eradicating a disease really, it has been done, and we, as Dr. Potter said, we've eradicated many diseases in some areas of the world, but it doesn't have the same impact as it did in the beginning. So you don't have this big fear about these vaccine preventable diseases as you had, in your parents' or grandparents' generation. They didn't, they're not gripped by these diseases anymore, and that is what we're hoping to achieve. So it might not be that there's no more COVID anywhere on the face of the earth, but we can certainly restore a greater sense of normalcy to our lives. And really the best hope for achieving that, and I would say the only hope is to achieve a certain level of immunity in the population. Obviously, I'm not the medical or the public health professional, but the vaccines reduce significantly. First, the main benefit to you as an individual is that it pretty much eliminates your risk of serious illness and death from COVID. It also limits your risk to others. So yes, you may have the virus, but having COVID and being able to transmit COVID is not necessarily one and the same. And if you have two persons, if you and I are vaccinated, and even if one or both of us have some sort of mild infection, then the risk between us is virtually nil. So the more persons that do become vaccinated, the more we're able to walk about freely, live our lives more freely without the fear of what COVID can do to us. If you have the flu, I'm not, fearful that it will take your life necessarily as much as if, you had a more deadly virus. So we can restore more normalcy to our lives as the vaccination rates pick up globally. But in the BVI, I am, proud of the community and the way that we have responded. I see some of the challenges in countries like Trinidad and Jamaica and, right here, our neighbors. And, the BVI community really are the true champions of this cause in terms of the way that we have responded and complied and contributed to the process of, we're all invested in making sure that BVI survives this, but comes out stronger, and we can restore our livelihoods and our community as quickly as possible. So with that same spirit of commitment to BVI community, I am certain that we will get there in terms of the level of vaccination that we're aiming for. It didn't happen as rapidly as we would have hoped. It's a shame that we're not able to use all the vaccines we have on hand before they expire, but we will continue to ramp up efforts to educate and encourage persons. And I think with time and experience, and I think we're still trying to get another option of vaccine available in the territory as well. And I think that will help. And I think we will get there. I think we're committed to seeing BVI emerge from this in a better place. So I'll hand over to Dr. Potter, and just to say thank you again for having us, and to all your partners for all that you've done and will continue to do to assist all of us in getting to that point. Thank you.
I am happy to say, if there's one place I would have wanted to be during this time, it's in the BVI. Not because I am involved with the process. It has been, for me, a good experience to see us take the issue seriously and to have the government support to begin to intrude in how people live and socialize, and to have complaints, but not a great pushback from our community. We've been forced to change how we live, work, play, worship. And that is significant. And you've trusted what we've put forward as the best approaches to controlling the situation, to controlling the spread. We've begun to gradually reduce the restrictions, and I'm pretty sure that that will continue to happen. I think my one disappointment is that I keep getting so many questions about, what about this treatment? What about that treatment? And I'm saying, do you really want to risk getting COVID? There's not, if you look at a scale, the scale of the harm that you can have from the vaccine is like 1 compared to the millions that you can have from getting COVID. And so there's no doubt that everybody who gets COVID don't have a mild disease. Some people have severe disease. We see it in the rest of the Caribbean. We've seen it globally. We have been fortunate. I think the fact that we had the PCR capacity and we just had to get the kits and to be trained in using the kits, that was a big plus. I think the fact that we made the decision to have restrictions early was a big plus as well. Because what happened with China was that it was over there. And we kind of felt it was going to remain over there, not remembering how much we do travel. And then the Western world took their people out of China without any precautions and brought those people back into the general population. When we made the decisions in March to close, it was a significant and painful thing to do, but we are a lot better off for it. It allowed us to build the capacities that we now have and to learn from the rapidly evolving situation, what kinds of approaches to begin to look at. And we had very good support from the UK, not just in terms of having the vaccines now, but I should be in another meeting at this time with the UK, actually, I have a meeting with them every Friday. So every Friday we talk COVID and COVID vaccines. And that has been a tremendous support. And when vaccines became available, we started talking about making vaccines available in BVI population in November. And we advised our government to pre-purchase vaccines from in November, long before we knew that vaccines would actually be ready. But you recognize you have a global situation, there's going to be a supply issue. And so better to be in the line than to be struggling to get into the line when the products became available. And then we had the benefit of that support from the UK to actually have the vaccines. And I would say on a personal level, I went to take the shot because on a daily basis, I'm being exposed to people that I have no notion of where they've been and what they've been up to. And just the fact that I live in a community, I'm very involved in my community, and yes, the visitations are not as much as they used to be. But when people drop by, they drop by. You don't know they're going to come. And so just being able to know that, okay, I don't have to worry as much of becoming seriously ill or fear of dying. It was a relief for me to go and get the vaccine. It was a relief for me when I had the second dose, and now I'm well past the 2 weeks. So that was the word that I said to a lot of my close friends and relatives. I worry when you are out there, and I worry when you come to visit me. It would be of great help to me if you get vaccinated, because every time you have a hiccup, I start to cough, and it's not comfortable that whenever you are in a situation where you feel you may have been exposed, you're really worrying. And I must say that my own position changed once I had the vaccine in terms of, okay, even if something goes amiss, it shouldn't be that bad. And in truth, I think people, I would say, well, if you don't prevent you from getting sick, why have the vaccine? Well, $50 is better than no dollar. Half a glass is better than no glass. And indeed, this half glass really has a lot of value in that this virus, even if it comes to, because what has happened is that initially there was a question about will the vaccine work against the variants? There's good evidence already that the current vaccines that have been approved, AstraZeneca, Moderna, Pfizer, etc., they have good effect against the variants of concern. It's also noteworthy that once you have been vaccinated, your body retains that in memory. And so if you have an exposure, making the antibodies to fight the virus is you already have that capacity. It's a very different situation to start it from scratch to recognizing it and then stimulating to begin to develop the antibodies. So if I'm to say one thing, it would be there is something that you can do to help yourself. There is something that you can do to help me. There is something that you can do to help your close friends and family. And there is something that you can do to help this community. Every one of us that is vaccinated adds to that protective layer that we are trying to build for the BVI. And I'm pretty sure that you don't want to be the person that takes COVID home to your granny or to your mom or to your spouse or to your child. And so if only you're doing it selfishly to not have to cross those kinds of bridges, on a personal level and as a good citizen, it is something to consider. I will never sit here and say that there are no risks, because there's nothing in life that is without risk. Even drinking too much water can make you sick. But indeed, this community has done very well in following very difficult measures. The lockdowns were awful.
Dr. Potter, since you're talking, one question is burning me. Any chance of getting a less controversial vaccine?
Good chance. This is a dialogue that we had back in November as well. Because by early December, we recognized that the vaccines likely to come to market, we would have a difficulty shipping them to the BVI. However, there are over 100 vaccines being made, pretty close to 200. And there's another vaccine will get, I'm not sure which one, but there's another one that will get approved this month. And there are others in the pipeline that will be approved. We've made approaches and have begun discussions with the UK. We've also begun discussions with the COVAX facility that we purchase vaccines from. So I feel secure in the notion that we will have opportunity to have another vaccine available for our population. So, however, as I said, my difficulty is we don't know what may happen in the interim, unfortunately. However, continue to be safe as you can be, for you, for me, and for this community. Thank you. Thank you for having me. If there are other questions that you have that you did not put in the Q&A today, can you please give them to Elise so she can send them to us so that when we have other forums, we can help to answer those questions for you.
We have one that's asking what's going to happen to the spare vaccines, but
we are likely to give them to some country that has a great need at this time.
Okay. I really want to say,
What I really would prefer is some of my brethren and sisters come forward and have their vaccines.
Okay.
As much as I want to help out our neighbors.
Okay. I want to say that BVI has been in a very privileged position. And being in this privileged position, I think it's attributed to the hard work, the determination, the commitment. And I know sometimes you all have been working 24/7 around the clock, and that kind of commitment, your level of professionalism and the expertise that you bring to the table should not be, underrepresented. And I want to thank you and congratulate you for being such tremendous professionals and for the great job that you've done in keeping the BVI in the position that it is in such a privileged position. And I hope that we can continue to be in one of those privileged positions as the countries across the globe. Thank you for all that you have done and continue to do. And thank you for taking the time this morning to come and talk with us and for answering our questions and for being available. We really appreciate Dr. Irad Potter, Chief Medical Officer, and we really appreciate Permanent Secretary in the Ministry of Health and Social Development, Ms. Patrona Davies. Dr. Potter, Ms. Davies, thank you very much. And thanks all of you who stayed on and who attended and offered questions. We really appreciate it. This has been another BVI Finance Forum, and we thank you. Do have a pleasant day. Good afternoon.
Thank you.